Hi, my name is Je Woramali. I'm with Obagi Medical, and I'm here with...
My name's Eric Keys. I'm with Refined MD. Jay and I have known each other for quite a long time, and we're very happy and pleased to be carrying her product line in our office.
Yes, and so we wanted to talk to you about some products that can really transform your skin as we're transitioning from the winter into the spring season, and masks are coming off. We want to...
Exciting time.
Yes, we want to unveil our beautiful skin, so we have a couple product lines that will definitely help with that. This is the NuDerm system.
Now, this is historically, this has been around for a long time, right?
Yes.
A lot of patients know about Obagi NuDerm.
Mm-hmm.
And what made this product line so successful, and why does it continue to be so successful?
So this is the first flagship product for Obagi. The NuDerm line is a transformative system that helps transform pigmentation. So as you can see from the photos here, it helps with sun damage and laxity, and also with fine lines and wrinkles. New derm meaning new skin. So we're truly transforming the skin to have healthier and new cells.
So this is a complete system, right? So all I need.
All you need. So this is a 4 to 6 months worth of product.
Okay.
From beginning to end. You've got your cleanser, your toner, your treatment products are here, which are hydroquinone at 4%, which is a safe level of hydroquinone.
What's the hydroquinone do?
And what hydroquinone does is it controls the cell called the melanocyte, and that helps with the pigmentation. It controls to make sure that the cells do not overproduce the pigmentation, and so that's how you get sunspots and all the little blemishes that you see that occur from sun damage.
And is there any requirement that you use prescription medication with this?
Yes, so hydroquinone, thank you for bringing that up. Hydroquinone at 4% is a prescription strength. You do have to see a physician and make sure that you're being monitored to be able to purchase, and it's going to help you through your journey as you're using it to have somebody to check in with to make sure everything's going all right.
What's this little magic here?
Yeah, so this is great. This is new to NuDerm. So when you do purchase a system, you can register on New to NuDerm, and it sends you emails to follow up with you, just to let you know how things are going. And this nice brochure that it comes with also gives you the information. So, the first phase, second phase, third phase, and that's what the emails will kind of trigger and let you know that you're on track.
It's kind of nice patient reminders.
Yes, absolutely.
So this is one of Dr. Swengel's favorites for pre-treating people before they have laser, and also to maintain the results that they get with laser treatments for pigment, to kind of keep that pigment at bay on an ongoing basis. He recommends this system a lot.
Yes, so that's perfect for pre-treating because, again, we were talking about the hydroquinone. It helps suppress the melanocytes so it doesn't have the reaction that we have to sun, which triggers pigmentation, heat, trauma, and hormones. So hydroquinone can help with all 4 of those factors. So if you're coming in to do something like a laser treatment, you want to protect your skin and pre-treat up to 4 weeks at most. You can do it as early as 2 weeks, but optimally about 4 weeks prior. And again, it's a complete system. We have tons of clinical trials on this.
That's one of the magics of Obagi,
yes,
isn't it?
Yeah. That's the difference between medical grade versus anything you get over the counter somewhere else, that we have lots of clinical data to back the claims.
Better for a patient with oily skin or dry skin?
So we've got there's 2 kits. There's the normal to dry and then normal to oily. So you have, it's very customizable for sensitive skin or skin that's more tolerable. We have the Exoderm Forte number 4, which is glycolic and lactic, so that's for oily skin.
Now I noticed you brought another kit here.
Yes.
But the Crx Kit, this kit here in the kind of the gold color.
Yes.
It looks like there's fewer steps or parts to this does it do the same thing, or what's the focus of this?
So for this one, also very effective, also a prescription product. We've got our hydroquinone and L-ascorbic acid combined, this is the night therapy cream, which also has 4% hydroquinone. So the difference between this system and this system is you want to think about the 3 C's. You want to think about the concern, the commitment, and the condition of the skin. So if somebody has more pigmentation and wants more correction, you're going to go for the big guns. That's going to be the Nuderm. And then if you or maybe don't need as much correction, maybe did a laser series and you want to maintain and you don't have quite the commitment level to use the 7-step system, then we've got something that's a little bit easier and combines vitamin C and L-ascorbic acid into one.
So the one key ingredient in this is the L-ascorbic acid, right? Powerful antioxidant?
Yes.
Is that also in the Nuderm system, or no?
So we actually recommend that you add that separately. We also recommend that you add a retin-A to the system. It's usually, so this is kind of a little marker, and you can include, the the retin-A right here.
Number one drug in dermatology, right?
Yes.
Retin-A.
Indicated for acne, and a side effect is fine lines and wrinkle reduction. But with this system, this is a really great powerhouse product. It's just magic in a bottle. It combines the hydroquinone and the L-ascorbic acid.
That's a serum?
Serum, yes. So if you're looking for one product that's going to truly transform the skin and like a quick, easy, product to add to your regimen, the C Clarifying Serum is a really great one.
Number one bestseller of these 2 lines in Obagi in our product.
In
a la carte purchases of this product.
Oh, really? Oh,
People,
wow.
our estheticians recommend it a lot. So yeah, and it comes in 2 formulations, right? Normal to oily or normal to dry skin?
Normal to oily, normal to dry. So if you
what
are...
do you do with the person who's combo?
Yeah. Tricky, right?
Yeah, tricky.
So if you're combo, you can go either way. So you can go with the normal to oily formulation all over the face, or you can use, say your T-zone, you can use the dry formulation and maybe just avoid the nose area if that's where you have like congestion and you're concerned about clogged pores. The normal to oily formulation is non-comedogenic, so it won't clog pores. However, the normal to dry formulation is a little bit more emollient, so a lot of people do like that. As you're coming in to a medical practice, generally patients are a little bit drier, older, so they like the hydration that it offers, but we have a nice solution if you are concerned with clogged pores. You can go to the normal to oily.
So, I mean, we're here in like nearly spring, masks off, weather's changing, cabinets will be changing, it's kind of refreshing. But what would you recommend that somebody could combine with one of these kits, like for kind of seasonal refresher of their skin?
Oh, I mean, if they're...
I know you have a lot of tricks up here.
Yeah.
In your bag.
I mean, this is a great standalone. What you see here in the before and afters, this is just from the products. 4 to 6 weeks on this system, and you're good. But if you wanted to combine with treatments, I mean, a Clear and Brilliant would be great.
Guess who joined us? Dr. Swengel just joined us, and I should fill you in. We have been talking about kind of, skin renewal, like winter to spring transitions. We've talked about how we use Nuderm and Obagi Crx in our practice with treatments. Any thoughts?
Yeah, I've been using Obagi for 20 years now. I've kind of watched Obagi go through multiple transitions. And, the Nuderm system to me is still a wonderful system, but it's for somebody who really needs to be dedicated to all the different layers of products you need to put on both morning and evening.
That's where that C for commitment comes
Yes,
in, right?
And the commitment's big with this one.
It's a big commitment, but it works. One of the issues I find is that because we're kind of a premier practice, we've got a reputation for being able to deal with pigmentation, is that a lot of people have already used Nuderm, and so that they've kind of like been there, done that. So the beauty for me is I could say, well, let's try the CRX system. It's a little simpler to use. It uses hydroquinone both daytime and evening so that they get the hydroquinone hit. And then what I do is, after they've adjusted to the CRX, then I just add prescription Retin-A or our product, what we call Tret-A, to it at nighttime. So they're in effect with this getting the Nuderm system just in a different format.
Well, the
Yeah.
other key ingredient is the L-ascorbic, right?
Yep.
In this one?
The vitamin C.
The vitamin C.
Yeah.
So you've got the
And in
vitamin
fact,
C.
I have to honestly say that when we have people with melasma who just don't want to go there, there are people who just say, I don't want to do, a multi-step system. That the CRX serum is probably our most favorite daytime product for people to use, and it allows us to really, decide if they're kind of on the dry side or the oily side, and get them the product. It gives them a high level of ascorbic acid plus one of their hydroquinones.
Both these products are products that we continually see measurable results when we use our clinical photography or Visia system, kind of similar to what's in the manufacturer's brochures. These before and afters aren't fake, they are real.
They are real.
They're things that we can reproduce clinically here in
Right.
And
consistently.
the effectiveness of one box, this is 4 to 6 months worth of product, and truly if you put it on your skin, it will work. So like you said, I know the Nuderm system is very effective, but not appropriate for everybody. The CRX system is a great alternative.
That's Dr. Swengel's favorite statement. If it's in your medicine cabinet and not on your face, it's not doing you any good.
I just always say that your product does not work if it sits in your top drawer.
Oh
It's
yeah,
gotta be-
no, absolutely not.
Yeah.
One of the things, I don't know if you talk about this a lot, but this is the C exfoliating day lotion. I know this is a really popular one, the serum, but this is a great one for anyone who's not treating pigmentation. This is a C exfoliating day lotion, and it has glycolic at 7%. It also has hyaluronic acid, vitamin C, vitamin E, and it smells really great.
Speaking of fragrance, do any of these products have significant fragrance? Or?
So this, out of all of them, probably, there's a little bit of scent to the C cleansing gel. It has a fresh citrus scent, so if someone likes, a scent, this definitely has that, and this product. But the Nuderm line, because we're, there's, it's a medical line, we wanted to keep the fragrance out, so it's very little fragrance in any of these products. Like the Hydrate, there's no fragrance at all, and that we want to make sure that there's nothing irritating added to a medical recommendation.
Well, and also I use Hydrate and Hydrate Luxe just for people who can comment that their skin's just dry. It's just amazingly kind of bland emollient that just soaks in and just leaves them feeling protected.
Yep, and I know you do sell a lot of the Hydrate Luxe here. This office does a lot of Hydrate Luxe. Hydrate is a great one, which has, it's a humectant, it's a hydromanil, and really great ingredients, and like you said, no fragrance, great for most people. It's very silky, and it's
Non-comedogenic. Would this be good for an acne patient?
You know what? It's it's not non-acnogenic. I don't know. Am I saying that right? It's not non-acnogenic, but it's non-comedogenic.
Interesting.
Yes, yeah. So it just means it wasn't tested on acneic skin,
A
but
couple places I
light
recommend.
enough.
Do you remember we used to travel? We used to fly.
yes,
Hey, we're
I
getting
remember
back to it.
that. I remember that.
The Hydrate was great when you're on a long flight.
Oh yes.
So it's something great to put on before you hop on the plane and just take it with you and have access to it during the flight, because it really helps to.
I do. I keep it handy because it's so dehydrating. I know something about being up in the air. This has clinically proven to last 8 hours.
Yeah.
So 8 hours of moisture. It's pulling moisture and infusing it into
Yeah,
the skin.
and one thing I didn't know, but it makes sense, is you can no longer take the aerosol cans with you. I used to take a small
the
spring
little
water.
Evian spritz.
Yeah, just to spritz your face, and then
but
you can't do that. So you
Yeah.
gotta kind of
So
trap that moisture
trap it in.
early on and
Early
keep it trapped in. Also, another thing that Hydrate can help with is if someone's really struggling with the use of Tret, that you can actually put the Hydrate on first and then put the tretinoin right on the top. And for some reason, it just kind of allows the skin to accept tretinoin a lot
It's
more
like
easily.
water. I don't know if it's just like kind of a base to protect or something, but that's a great trick. Yeah. So if you have flaking and sensitivity from tretinoin, it's great to just flop them. Just put it on first and then the tret next. But you've been recommending this system for a long time before Hydrate was not in the system.
Right.
Yeah.
It's a new addition,
It's a
relatively new addition.
Yeah, relatively
Yeah.
new addition. But
So beyond these two, these are kind of core products with the Obagi line, but I know you have like a few other tricks
oh,
up
we've
your
got a
sleeve. You got something hiding
ton.
back
We've
here.
got a ton. So we've got a brand new product here. This is Nusil.
Uh-huh.
Nusil is our lash product, and this is a wonderful new addition to the line because everybody's looking to enhance and lengthen their lashes. So that's what Nusil does. And I wanted to show you
How does it work?
the applicator. So we have a proprietary blend.
I knew you were going to tell me.
We have a proprietary blend, but I can tell you that there is biotin in it, and you know, biotin is in most like hair supplements if you're looking
Is it flammable?
well, I don't know if it's flammable. I mean, you want to keep flames away from your eyes.
Yes.
But what I really want to show off is not only the proprietary formulation that helps enhance and lengthen lashes. We actually tested in a clinical study, so we did outperform the market leader, who I can't name by name, but we did outperform, and some find it less irritating, but most people are enjoying the applicator. So
it applied right at the lash line?
right
yeah?
at the lash line.
So there actually is a growth stimulant in the product?
It extends the anagen phase.
Okay.
So yeah.
Which is the
Competitive
growth,
claims. What?
which is the growth phase with the hair follicle, right?
Right.
Yep.
So that's the active growing sign.
Yep, and so there's biotin in it, which helps, make the lashes thicker. And then we also have sodium hyaluronate, which helps plump at the root.
So how long do you have to use this before you notice a difference?
So in the clinical study, the first marker was at 4 weeks. However, using it myself, I noticed lengthening after 2 weeks. But clinically, they started marking it at 4 weeks, and then another one at 8 weeks, and then at 16 weeks.
So thank you all for sharing our skincare tips for winter to spring. It's been fun seeing you all. Just want to reward our visitors today on our Instagram. If you see our most recent Instagram post, address is right here at the bottom of the screen. You have a chance to win 3 valuable prizes. We're going to tell you about them right now. Dr. Swengel?
Here's prize number 1.
This is a wonderful prize. We've got the C Cleansing Gel, the C Balancing Toner, and the C Exfoliating Day Lotion.
What else do we have?
Well, this is the one with the new peel.
Oh yes, so this is a brand new peel. So it's called Obagi Revivify, and it's a multi-acid peel with kojic acid, lactic, glycolic, and salicylic acid. And this is a great at-home peel to help reveal your skin's true potential. And in this box, you've got the peel prep and then the peel. So super easy to use, very little downtime for that, and instant glow. Just think about, getting ready for an event or something. You would do this a week out. And we also have the cleanser, moisturizer, and sunscreen.
Nice.
Every skin deserves a peel now and then.
Yes, that's a great way to transition from winter to spring. Another way is to start using your antioxidants. So this is the Pro C 15%, recommended for combination skin, and a powerful antioxidant to help fight free radicals and prevent aging, and also sun damage. So this pairs really nicely with the Nuderm system, but as a standalone as well. And also there's a little gentle foamy cleanser in there.
Great, thank you. So hopefully you'll be pleased with the prizes if you're a winner, and if you're not, feel free to visit us in our office. We do offer in-person consultations with patient care coordinators, with estheticians, and with the physicians in the office. And we'll kind of set you on the right track. Did you want to add
Well,
something?
actually, another thing I think it helps too when you come to the office, so we have a system that assesses the amount of pigmentation, your texture, pore size. It's called Visia. And I just it's really nice to establish a baseline, because our skin changes so kind of quietly and gently that people kind of say, I see nothing. But then you do a picture from the start and then now, and they go, wow, I had no idea. So
You
it's
forget.
a really great way to remind you that you are moving in the right direction. So visies are really important.
Awesome.
Thank you all for watching.
Thank you.